So again, another older video, but nothing's changed a great deal. When it comes to having mouth ulcers, you want to monitor them, and you should really check your mouth once a month. So as it says there, if in doubt, check it out. Anyway, the video's quite long, so better get started. This video is about lumps, bumps and swellings and ulcers in your mouth. You'll need good lighting to clean your hands and possibly have someone with you to take a photo on your phone. You need to palpate for swellings. If you get small nodular swellings in your neck or under your jaw, that's the sign of an infection, generally a dental infection. You should regularly look in your mouth to see any lumps or bumps once a month. The most common cause for swelling at the back of the mouth is of course the wisdom tooth. These normally come through from the age of 18 onwards, and they give a swelling that's quite painful. Sometimes the swelling can be resolved quite easily by keeping the gum clean. It can be impinged by the opposing tooth, which makes it more painful, or you can get food debris under the flap of skin and you need to clean that out. Generally electric brushes are very good, and you can also apply Corsetil directly using a baby bud, and analgesics as appropriate. If the swelling persists and you have difficulty swallowing, difficulty opening your mouth, then that's the time to get in touch with your dentist, and you may need a course of antibiotics. There is a separate section on pain management within the app. You can also get a dental abscess, usually related to a large filling or a broken tooth. You can have an abscess when your tooth seems nice and healthy, and the likely cause is gum disease, so that's a periodontal abscess. And with both, sometimes the abscess bursts and drains into the mouth and then resolves for a period and gives no further problem for a while. Normally periodontal disease is associated with bleeding unless you smoke, and you may be one of the 10% who really has to spend a bit more time cleaning the teeth to keep the gums healthy. But when the opportunity arises, you must have an X-ray taken so we can diagnose, treat or monitor the condition as appropriate. As part of your dental examination, we monitor your gums, taking a score which is called a BPE, which is explained within the app. Improve your BPE and your teeth will last longer. There are some videos within the app as well as a scoring system to help you do this. Most common ulcers are caused by ourselves having something too hot to eat or biting our cheek, and we get irritating abscess ulcers, but this is how you deal with all of them. Generally they heal within a couple of weeks, but if you're suspicious, then it's a good idea to take a photo and make an appointment with your dentist. Now more than ever, we need to use modern technology to help with our diagnosis, especially if we have to see one another without compromising our social distancing. One of the major concerns in dentistry is oral cancer, and that's why we ask you to move your tongue around and have a look at the roof of your mouth and the floor of your mouth when you have your examination. But you can look after yourself too by just following the simple instructions within the app. There's also a scoring system to monitor yourself, and when you complete the risk factors, it shows your risk of oral cancer, so now's a good time to change those bad habits.